It's early evening, and on patrol in his rapid response vehicle is paramedic Jason Sefton.
First job of the day, and it's a male who's fitting.
Jason is only sent to life-threatening emergencies, classed as red calls. He must be there within 8 minutes.
When you're fitting, you don't breathe. So, I mean, the gent isn't breathing at the moment, and he's under that bridge. I mean, we're right on top of it, so he still will be fitting. 515 on scene.
Adrian Rice. Yeah? Hi, name's Adrian Rice.
Adrian Rice was out shopping when he collapsed at a crowded bus stop.
Hello there.
He's just coming through now.
All right. Was he actually fitting, was he?
He has fitted, yeah.
Okay.
He's cut his head
Adrian.
off as well at the back, yeah.
Adrian, how do you feel now? Feel all right? Do you know where you are? Hey. Yeah. We'll give him some oxy, and then we'll look at his head. It shortens this post-ictal period, you know, where they're groggy, confused and stuff. Pop this on, mate. There you go. Is anyone with him? No?
No, mate.
Adrian, let's have a look at your head. As he's bumped about, he's just sort of banged his head away. He has a small scalp wound. Your head's very, very vascular, exceptionally vascular, so it bleeds a lot. We'll just put a dressing on, just keep it clean more than anything. Adrian, you're all right, mate? I'm just popping this on your head, just to keep it clean more than anything, OK? All there.
34-year-old Adrian has been epileptic since birth, and although he takes medication, he cannot control his fits.
I was just coming over from the market, and there was people on the floor with him lying on, and he was lying on his back. I just noticed, like, he was taking a fit, so I just said, can we get him in a recovery position? Got nothing out of him for about 5 minutes till he started speaking, and told us his name and that, and then he said he was epileptic, like.
Well, if we sit him up, I mean, he's out the way, no one's going to trip over him, it's just much better for him. How are you feeling now? Feeling all right? Feeling better? Good. When was your last fit? Can't remember. Listen, you've cut the back of your head, so, I mean, we'd like to nip you down to the Royal, get you checked up. Hiya, this gent, he's had a fit less than a minute. I was only on the corner of Green Lane. Gets here, he was conscious and alert.
Do you want to sit in the ambulance for a few minutes and just get your bearings, yeah, and then we can, yeah?
Okay then.
Oh,
you go.
brilliant.
There you go.
Okay, let's just get you in the ambo and then it's a bit warmer there, out of the way.
You're going to you. Cheers, Tarfish.
All right, I'll see you later.
See you after. Thank you very much.
The ambulance crew takes Adrian to the Royal Liverpool, leaving Jason free for another emergency response.
Patient's gone, so I'll slide off and leave him with them. That's the whole point of why we have these cars, because we can get there quite quickly. He'll live. Another life saved, eh? The only palpitations probably going pain.
In the Royal Liverpool's emergency department, Registrar Mark Buchanan is working the late shift.
So we're on top of things at the moment. We have 2 in the box to actually physically be seen. I just check resus now. Is that right? Yeah.
John Atkinson has been brought in by his boss following a fall at work.
Did you fall off some scaffolding?
Off a ladder. Right, off a flat roof. OK, mate. So I'm Mark the Registrar. Now, you're John, is that right? How high was the flat roof? Was it a normal 1-storey flat roof, or was it 2 storeys? About 15 foot. And where did you land? Are you back, your front, your legs, your heels? And so you landed on your feet, effectively. Now, pain. Have you got any pain anywhere? Where?
On the bottom, this leg.
What about your back?
Fine.
What about your neck?
No.
Are you able to sit up?
Yeah.
And you've got no back pain at all?
Mark checks for any hidden injuries.
And your neck's all fine as well. I've certainly seen your movement, so I'm happy. You lie back for me? How bad's the pain in your heel?
Oh, it's edible.
So what do you do for a living?
Builder.
Which heel sore, my friend?
Sorry, I'll be careful.
He's certainly got some swelling over the back of his foot on this side. You okay, is that sore? No. Not at all. Now, that's sore.
Yeah.
Sorry, mate. What I'm doing at the moment is basically popping a cannula into the back of his hand, which basically means I can give you a really, really good pain relief, which is morphine. So this is when I get back for all the workmen who have not turned up to my house that have said they were going to, and I've taken time off. Revenge is sweet. It's me trying to make you relax. You okay there?
Yeah.
We need to get your x-rays, and I'll review them as soon as we get them back.
I just remember getting off the ladder and then all of a sudden I was down. Can't remember what happened. You're trying to save yourself, you know what I mean? Everything's focused on anything else.
Aha! Speak of the devil. What you can see is a fracture through here. But there's also probably a fracture here as well. On this view, which just looks at the heel itself, again you have the fracture which you can see through here. So I'm glad that's not my heel. Right, boss, you certainly have fractured your heel. It's not a nice fracture. Okay, it goes into the joint, and that certainly means that I need to speak to the orthopaedic doctors. I think you probably need an operation. You're going to be out of action for a good few months. Just means you've got to put your feet up, doesn't it, and just relax. Okay.
Okay, Mike, thanks.
My pleasure, my friend. Take care now.
In between red calls, Jason keeps moving, covering over 100 miles a shift.
Right now, we're actually on patrol in the Anfield area, but we're just sort of floating around, waiting and waiting. You never know what you're doing in the next 10 seconds, never mind in the next hour.
Occasionally, he comes across a familiar face.
Where's your mum? I've just bumped into my daughter. Where? Where's down there?
There?
I said to her, so where's mum? She said, oh, down there. They're my children. Hi. 3 of them. I've been working, mate. I've been saving lives. I'm working really, really hard. I'm going to do your own work. See you later, loser. You shouted at me.
Love you, Dad.
See you then.
See ya.
Bye-bye, kids. Very, very, very proud of them, yeah. They're doing well. They tried their hardest in school, and we've got a job.
Jason's off on another red call.
Oh, there. What are you still doing here? Man.
Just on duty, covering the late shift, is consultant Ara Supaya.
I like one night shift a week. I wouldn't want to do night shift every day. It's busy, but you know, you control the whole department, and it's quite nice. We couldn't do that every night. We'll die.
His first patient is amateur boxer Matthew Barrett.
Let me get the story. You were boxing
I was sparring.
in the ring.
Yeah. Took a step back and just went over my ankle.
Simple as that.
Simple as that, yeah.
So the first thing I'm going to do is I'm going to put a needle in the back of your hand. This is going to give you some morphine for the pain, because your ankle is dislocated. And what we need to do, give some painkillers, and then put it back in place.
I was sparring at a local boxing gym. I was going on the defensive, so I was taking a step back. The other lad was coming in, and I stepped to the side. My leg just went.
Can I draw a little cross on your foot just where your pulse is? Is that all right?
Always when you dislocate a joint, you need to save the joint basically, and you need to save the artery in the leg. It's a medical emergency. The longer you leave it, the more likely the nerves will get bruised and it might be permanent. So we need to do this really quickly, really. All right, have you had some gas in there? Okay, let's take the oxygen off. Gas in air is a painkiller. It's what pregnant ladies have, and they can go through labor with it, so I think you can squeeze the baby out. You might be able to get an ankle back in, the same thing. You're not pregnant, are you? Head back. Put your head back. That's it. You're doing great, mate. But I want you to close your eyes and just concentrate on your breathing for me. Okay? Nice, big breath. Okay.
Well done.
There we go. It's all done. Sit. Big breath.
You're doing really well, mate. It's finished.
Matthew will have his foot in plaster until his ligaments heal.
You soak it out. I hate it. I don't even do DIY me.
You're doing really well, mate.
It's very important not to put this on too tight, because once you reduce the joint, all the blood flows in it and all the tissue starts swelling up. Don't need any more of that. Give me that, you. From the high as a kite.
Just started training like properly for boxing. And it's just a huge setback.
It'll be 6 weeks before Matthew's back in the ring. And he's not the only person with sport on his mind.
Barry, who's Liverpool playing today? Brighton. I only support one team. Bright red they are. The only team worth supporting. Liverpool.
Also on duty tonight are ambulance crew Phil O'Brien and Andy Orme, and they've just heard the football scores.
Liverpool were beaten 2-0 tonight, and I'm ecstatic. I don't know about you, Phil.
Yes, very happy for the change.
We're Evertonians, and we're bitter.
Just like Liverpoolians are deep down.
And we're now going to the Liverpool 8 area for a 9-year-old male with difficulty in breathing.
Ibrahim Mohammed has woken up because he can't breathe properly.
Yeah. Does he have asthma or anything like that?
No, no.
How long has he been coughing for?
Just tonight. He actually started coughing.
Has he brought anything up?
No, just woke up coughing, crying, asking for water, saying that he could hardly breathe. And we're quite worried.
He's quite wheezy, actually. He's got a bit of an expiratory wheeze. Sounds a bit like he might have a touch of asthma. What I'm doing now is put some oxygen on him. Try and ease that wheeze. OK, Ibrahim, just put this on your face. OK.
4 people die from asthma in the UK every day.
But he's never, to your knowledge, had a problem like this before?
No.
His airways are a little bit narrow, so we need to open them up. He needs medical intervention. He needs to go to hospital. OK, mate.
Although Ibrahim has no history of asthma, he is having severe difficulty in breathing.
OK. Breathe out. Do you find it difficult to breathe out? You do? Yeah, OK. You can breathe in, but it's getting the air out because the airways are so narrow. He's going to require more tests.
Ibrahim is taken to Alder Hey Children's Hospital.
Obviously, if left, asthma can be life-threatening. Luckily for Ibrahim, parents were on the ball, so yeah, job's a good one.
How are you doing, Dr. Green?
Mark Buchanan has come through to minors.
This is Mark, who's unfortunately had a glass in his hand, probably alcoholic because he's a medical student, and unfortunately fell and it broke, causing him to have a cut in his finger. What part of medicine do you want to go into?
Quite fancy A&E actually, but I'll see how it goes.
You're only saying that to make me look after you better. Can you feel me touch you there?
Yeah.
Can you feel me touch you there? Can you feel me touch you there? That normal.
That side's less.
That side, half. What I want you to do is bring the end up of your finger up there. Keep it there, keep it there. What I want you to do is bring your finger up, keep it there, keep it there. Stop me pushing. The only worry is about the fact that you do have this loss of sensation here.
The lack of sensation could mean a severed nerve.
What I want to do is have a really good look and see the depth of this cut. It's certainly important to worry about the sensation loss. I just want to make sure there's no other damage there. So what we're going to do, mate, is we're just going to have a good look at this and see what we can see. I'm actually just going to inject directly into the cut. Now that might seem horrible and barbaric to you, but in fact your nerves are when I go through your skin, so this will actually in a way be kinder.
So Mark can do a thorough examination, he anaesthetises the wound.
Just going upstairs and I slipped on the stairs and I was carrying a glass of water and I smashed my hand through the glass. It wasn't a pint of lager, unfortunately, no.
You don't particularly see any deep structures being involved there. It's surprisingly superficial. I have a quick word with the plastic surgeons to see whether or not they want me to just close that up and actually get you seen in sort of their trauma clinic. Just bear with me.
Yeah, probably about a pint and a bit of blood. More blood than there should have been. I nearly passed out at one point, but slice sat me down, that's all right.
Right, boss, amputation is the only way forward. I'm sorry. What I need to do is pop just a couple of sutures in there, about 2 or 3, and you need to be seen by the plastics people tomorrow.
Temporary stitches will hold the wound together until Mark can be seen by plastic surgeons in the morning.
So what year are you in?
Student Mark won't find out until then if he has permanent nerve damage.
Although it was deep in that cut, I couldn't see any damage to any obvious tendons, which is one thing we obviously worry about. But clinically, there is a change in sensation, and that's really the only worry and why we might need to follow things up.
Responded to a red call in the Liverpool 6 area for 28-year-old with chest pains.
Max Austin can feel his heart beating very fast.
Do you want to tell me what's wrong?
My heart's shaking, sweating, my heart's pounding on my chest.
When did this come on?
10-15 minutes ago.
Were you asleep?
I've been in, no.
Were you in bed?
Yeah.
Well, all right, should we get you on the ambulance then?
On the ambulance, Phil carries out routine tests.
Okay, Alan, just relax for me while I do your blood pressure now. If you get tingling in your fingers, you're very nervous. Do you have panic attacks? Andy, heart rate's about 214. But just try and slow it down if you can, just try and relax.
This is quite a severe attack. It's the heart rate's well over 200, so yeah, it's quite severe.
The ECG shows Max's heart rate is 3 times faster than it should be.
It's called supraventricular tachycardia. It's just a very, very fast heart rate, and part of the heart muscle isn't firing properly, so it races really fast. Just think to yourself now, I think it's going to be alright, just squeeze that for us. I can give you something now which slows that heart rate down, okay?
It's not uncommon for attacks like this to occur in young people.
His heart rate's dropped now, so it's settled down a little bit.
So it just kicked off. Did this wake you up?
Do we have to tell you?
Yes, I've got to write it down.
We just finished then.
That's what's caused it, isn't it?
We were lying back, talking, and then kicked off.
Max and his girlfriend had gone to bed, but weren't asleep.
It's actually celibacy for now, mate. Total abstinence. Listen, you start again, what's going on?
Leave him alone. What's up with you?
Max will need more tests to discover the cause of the SVT.
Feels like very scary. Feels like you're going to collapse. Most of your muscles in your body start shaking. That's just, I don't get scared by anything, but this really scared me.
He's just had an ECG now. We found a couple of things on the ECG which are going to need further investigation. He also needs to abstain from nighttime activities.
Will you stop canoodling? Goodness me.
I think Phil's barely alive, let alone have a fast heart rate. He doesn't do enough to raise his heart rate. The only time I've got a fast heart rate is if I'm parked with money.
My heart beats fast when I watch Everton in the cup final. They were a nice couple, weren't they, at the end of the day? Isn't love a wonderful thing, the things it does to you? Aye.
Ara is called to see 50-year-old Lawrence Grant, who's been brought in with abdominal pain.
Now, what's been going on with you?
Indigestion pain.
Okay, indigestion pain right here?
Yeah, around here.
Okay.
Feel hot at the top.
Yeah.
My hands feel cold.
Okay, whereabouts is the pain?
Yeah.
In your tummy here. Is that so there? There. He's got tummy pain which has come on very suddenly. What we need to do is get a heart tracing on him. Where's ECG? Are they coming? We need to fast bleep them, right? Please, yeah, can we do it urgently? Thanks.
Without wasting any time, Ara starts a process of elimination.
That will tell us whether or not he's having a heart attack.
Samples of blood could indicate what's going on inside Lawrence's body.
All right, so sharp stab. Would you rather sit up or you want a lie flat? Okay. I'm going to get an X-ray of your tummy as well, okay? I'm going to start you on a drip. And we'll see you with all the blood tests and stuff. I don't know what it is. But, you know, what potentially it could be, they're all serious.
The blood tests are sent straight up to the hospital's laboratory.
We've got an emergency call. And this is close to a popular nightclub in the Anfield area of Liverpool. Very famous nightclub. And it's someone who's unconscious after an assault. Hello, mate. Has he spoken to you at all? Has he stamped on his head, mate? Yeah.
He's breathing, but he's obviously.
Jason checks his level of consciousness.
His pupils are equal and respondent now.
I seen a lad hit another boy, and then he started standing on his head about 7 times. So I ran over and told him to pack it in, and he ran away, started fighting with someone else, and the lad was pouring with blood. I was trying to keep him awake, but he was just flat out unconscious.
Well KO'd so far. He's breathing, pulse is fine, obs. He's been stamped all over like that.
I don't know the lads, I was just walking down with my friends and I seen it happening. I wouldn't like it happening to me, I wouldn't like someone walking past me when I was getting attacked, so I just stopped, seeing if he was alright.
Listen mate. Don't do nothing too quick, stay on the floor, lad. Stay on the floor. We're paramedics. Listen, lad, you're not. Stay there, mate, you're not alright. You can't even stand up, mate.
He's been assaulted by a much bigger guy for no apparent reason. He's punched him, knocked him out, knocked him to the floor and then proceeded to stamp on his head, which is why he's in such a... well, he looks quite serious.
Listen, mate. Come on, mate. We're gonna take you to the Aussie, lad. We're gonna get you inside here first. Sit down.
Sit down.
No. He's a thin lad and he's not a big bruiser, he's a small lad.
He's harmless,
He's harmless, There's this here, that's stable, you can see that. You can see how much it moves, look, it's that swollen, you see. Let's see, mate. I mean, you look at his ears actually bruised where he's been stamped on that much. His blood pressure's normal, which is a good sign up to now. Doesn't mean there's nothing there, but it's just a good sign. Whisk him off. The lads can go with him now, I'll jump out. He'll be kept in overnight for observations at least, and depending on what they find and if there is any head injuries or other injuries, I mean, God knows, because he's had a good kicking. His mum won't recognise him in the morning.
He's just got a little bit worse, actually. He's dropped his blood pressure now. This area.
Lawrence has deteriorated suddenly before his results are back from the lab.
I'm going to put some fluids up. You know, at the moment, I've got no blood test, nothing. I haven't got any x-rays, nothing back on him, so...
Ara can't treat Lawrence until he knows what he's treating him for.
You're right there, Lawrence. I'm getting there, matey.
I just want to scan his tummy really quickly as well. The aorta is a big blood vessel that runs along the tummy. And sometimes you can have that, and that can leak as well, so I just want to double check that's what it is. Lawrence, you okay? All right, okay. All right, Lawrence, you're going to feel something cold in your tummy, okay? Sometimes you can, if they bleed, you can see fluid in this machine. There we go. Just a lot of bleeding into the tummy, mate. All right, give me the line, quick. If we got ONAC, give me ONAC, 2 units now, please. We need to hurry up. Let's go. Let's just get the line in, because we're going to lose him otherwise. Lawrence, you with us? Good man. You're doing well, mate. Get me 2 units now, please.
Ara has to replace the blood Lawrence has lost.
Send this off for an urgent cross-match. Ring the lab and tell them the sample's coming right now. Lawrence, do you hear me? Something's bleeding inside your stomach, mate. It's probably an ulcer, okay? All right? You're going to need an operation, I would have thought. Lawrence, you're doing really well, mate. Just hang in there for a minute. I'm going to speak to surgeons, okay? I need a surgical urgently, please. Can you fast bleed them for me, please? Or voice over them, ask them to turn up to resus.
Without an operation, Lawrence will die.
We have to take him up. We have to monitor him as we go up, you see, because this is life-threatening bleed. Removing him out of here to theta is the worst place for him. The last thing you want is to be stuck in a lift with no equipment. He's very lucky. If this happened somewhere far and he didn't come to hospital, by the time he came in, he could have been dead.
It says on my screen that there's a 65-year-old lady and she has no electricity. Hello, hon.
The panic is because the electric's all gone out. I'm really sorry to bring you out, but you can't breathe.
You're sounding really chesty there, honey.
64-year-old Margaret Whelan has lung disease and needs 24-hour oxygen.
She has a fast heart rate of 110, which is bound to be under the circumstances. What I'm going to do is put that on quite powerfully just to pink it up a bit. You're all right like that for now. Right, well, what's up with your meter? Here's a look.
Margaret is safely on Jason's oxygen, but without electricity to power her own supply, she'll have to go to hospital.
Main switch on. Something's tripping it. It's something that's plugged in, that's tripping everything. So what I'm going to get them to do is go around and unplug every single device in the house, except the oxygen machine. It's your ring main that's tripping. your plug sockets. And your mum let you touch plugs? I want all devices unplugged except that. If we unplug everything except that, and that works, this lady's problem solved. How are you feeling now, chicken? Sat's 99 and her pulse is now not tachycardia. 99.
What kind of oxygen have you got?
Oxygen's oxygen, honey.
This is a miracle.
Listen, that's because it's ours and it's powerful. You don't be left on that. That's why I'm sorting your machine out. Bear with me, chicken. I'll get you sorted. Have you unplugged everything in the bedrooms?
Jason has another go.
I've got your lights on. Staying on. We'll unplug non-essentials for tonight. So we will have your oxygen on, a lamp and your machine. Can we slip this off, yeah? Pop you back on your own. I'll tell you what, you're looking a healthy glow there with Sats of 99, eh? Anything else? Like a quick back rub? Essential oils?
No.
Are you sure? I'm quite cheap, you know.
With my own oxygen now.
With Margaret back on her own oxygen supply, she won't need to go to hospital.
Right, so you're happy now, aren't you? 515. Hello, love. She can cancel the ambulance now, please. I've got her oxygen machine back on. I mean, she's sorted for now. All I've done is unplug every non-essential device in your house so that you're not overloaded.
For you, I would have ended up back in, and I didn't want to go back in.
But you're not going there tonight, are you? Not now.
You've done me Sats, that's all right. I'm made up with that. Thanks anyway.
Come on then. Ta, honey. See you soon. Take care. Ta. See you now.
If you hadn't came, we'd be in panicking by now. We'd have been, back in hospital probably.
You've got no electricity, you've got no oxygen, you've got no nebulizers. It's a real poor position to be in. Something's overloading the system, tripping it all. So she's got lights, she's got a kettle, she's got a neb and she's got oxy. That'll do me.
Adrian's head needed 4 stitches. He left hospital the same day. Mark partially severed a nerve and has not yet regained the full use of his finger. John was on crutches for 13 weeks and is still receiving physiotherapy. Although badly assaulted, 21-year-old Frankie walked away with no serious injuries. And Lawrence was given over 8 litres of blood, but surgeons successfully saved his life.
Brand new Spooks at 10:30 tonight on BBC Three. MI5 not 9 to 5. See, I just can't help it. And next, it's EastEnders.